Welcome to Turning Point. I'm Becky Alfrey.
And I'm Jessica Alfrey. In a world that's geared towards being faster, fast cars, fast internet, and fast food, it's easy to fall into an unhealthy lifestyle.
Bariatric surgeon Dr. Ramy Awad is changing lives and in some cases even curing diabetes with procedures that are a lot safer than we were often led to believe in the past.
A bariatric surgeon is a surgeon who specializes in morbid obesity or surgical options for patients who are morbidly obese. We have different options for our patients, but bariatric surgeons are surgeons who specialize in minimally invasive options for morbidly obese patients.
Does it ever have to do with a diabetic patient? And in other words, that another doctor tells them that they need to have this surgery? Does that happen?
It does. So being overweight is associated with a lot of weight-related comorbidities. Diabetes is very closely linked to obesity. And these surgeries are not considered cosmetic surgeries. They're really kind of surgeries to resolve weight-related comorbidities, give people quality of life back, and kind of increase life expectancy for these patients. So one of the biggest things we see is patients who are diabetic. And diabetes in and itself has a lot of different implications. You can have a lot of different problems. Secondary diabetes, patients lose limbs, their kidneys fail. So diabetes is one of the big things we address with these surgeries.
Can it cure diabetes?
Well, we don't
Take
say
it
it
away.
cures
Okay.
diabetes. I think what it does is it puts it in remission.
I see.
And there's really nothing out there that controls diabetes like bariatric surgery. So bariatric surgery is one of the fields that really has a profound impact on diabetes within days. We get patients we see patients who are insulin dependent, brittle diabetics who within days after bariatric surgery are not taking insulin. So there's a lot of benefits to the surgery that are independent of weight loss and are a result of the metabolic benefits of the surgery.
This is a life-changing choice when people have bariatric surgery. What keeps them on a good path? After they have the surgery, they have weight loss, they still have those habits.
It's tough because these patients, they have the physiologic restriction from the surgery, and these surgeries really kind of address the what we call neurohormonal aspect of things, meaning it's not purely restriction that causes weight loss. It's really how your brain perceives fullness and satiety. These surgeries address it, but it's tough. I tell my patients, this is going to be work. You're going to be doing this every day. It's a full-time job. It's a combination of surgery, diet, and exercise, and they have to understand that. These surgeries control the portion size, but you have to make good dietary decisions, and you really have to kind of integrate a good physical activity regimen.
So you would recommend that they start an exercise regime before the surgery or after?
Well, we like before. A lot of patients have degenerative joint disease, a lot of orthopedic issues, and all that excess weight really kind of exacerbates it and makes it worse. So the nice thing about these surgeries is that when you take off 100 pounds off a patient or 150 pounds of a patient, they're much more active, they tend to be more physically inclined to do activities, and really these patients, when they see the results, they get motivated and they want to go to the gym and they want to show off their new body. So
we're going to be talking to
easier.
some patients that have changed their lives, in fact, and done exactly what you're saying. Started taking better care of themselves and eating better and working out.
I never thought of myself as fat until after I had surgery and I started losing weight. Then I thought, oh my God, why didn't somebody tell me I was the fat girl in the room? Because I never thought of myself. I mean, I wasn't lacking for dates or relationships. There's always a chubby chaser out there somewhere. I had initially gone to my primary care doctor, telling him that I was tired of being the fat chick and that I wanted to make a change in my life. So he gave me the name of 2 doctors, and I called one doctor, and with one doctor you had to do a 3-hour class, which in this day and time, I don't have the time to go to a 3-hour class. That's mandatory before you can even meet the doctor. So I obviously chose the second doctor, or the doctor in this case, which was Dr. Awad. I came to his office, and when I met with him, I told him, I said, I don't want you to tell me what surgery I'm going to have. I'm going to tell you what surgery I'm going to have. And the reason being is I was not a portion control person. I was a sweet eater. And never mind a slice of pie, I want the whole pie. And I knew my downfalls, and I knew what surgeries would do and the complications or the repercussions of them. And with gastric bypass, if you eat too many sweets, you get actually sick, almost like a diabetic coma. And I needed a slap on the wrist every time I ate sweets. And I knew that the surgery wasn't going to change that portion of my life, but I knew that it would be a step in the right direction. So I chose the gastric bypass, and I started out roughly at about 268. But after a certain amount, it doesn't matter if you're 250, 275, 300, you're fat, you're fat. And I don't want anybody to mistake it for I was, thick or I was chubby. I was fat, and I knew I was fat. But if you looked at my pictures back then, I just thought I was a little thick, a little on the fluffy side. And so I knew that. It's funny, doctors ask you, oh, do you have a problem getting a date? I go, a date? Look at this. Would you have a problem with this? No. So it didn't matter that I was thick. I just had, some extra weight on me. I was still cute. I still had a personality. So it was what it was. And I started off roughly about 268. Within a year, I had less than a year, I had actually met my goal. My goal wasn't a number, a weight. It was a size. I wanted to be a size 14. I was always a size 14. I was happy with a 14. And my mother said, well, after you reached your goal, what did you want to be? And I said, just me. It doesn't matter. And I quickly went from a size 3X, and women will know a number, men wouldn't, but I was a 3X. I went by January, February, I was a 14, and by June, I was a size 4. And then within the next year or so, I went up to a size 6, and I think that's where my body was saying, hey, this is where you're supposed to be at.
Dr. Awad, you were in medical school and you chose a certain type of surgery to be a surgeon. Why bariatric surgery?
I think it impressed upon me with a lot of the mentors I had in training. There's really nothing that you see profound. These are life-changing surgeries for patients. Obesity is becoming a growing epidemic.
Right.
And where I trained at Irvine, at UC Irvine, and we had some very prominent surgeons there who, when I trained with them, we had a very robust bariatric program. You see the transformations in the patients. It's really kind of very rewarding. Sometimes you go home and you feel good about yourself. These surgeries really kind of give patients a new life. Their confidence is improved, their quality of life is improved. They do it because they want to run after their grandkids, and now they have more time to spend with their grandkids. It really helps with their weight-related problems, which simple things like tying your shoes, simple things like breathing at night and sleeping flat. So these surgeries really kind of have a profound effect on patients' lives, and I think it was for that reason I wanted to go into it.
So you actually liked it because of the positive aspect and the life-changing aspect that it improved quality of life.
These are really kind of life-changing surgeries, and what really kind of impressed upon me was the fact that everybody would come back and say, I feel like I have a new life, I feel younger, and their health problems get better, and they're able to spend time with their kids and take them to the park. So these surgeries really kind of give patients their lives back.
If someone is overweight but not morbidly overweight, 30 to 50 pounds overweight, would they be a candidate for bariatric surgery if they wanted to be? Is this a choice?
It's not a choice. So there's guidelines for who's a candidate for surgery. And these really were established by the National Institute of Health back in '91. And it's based on weight and weight-related medical problems. So the current guidelines for someone who's a surgical candidate for obesity is someone with a BMI or body mass index of 35 with one or more weight-related medical problems, or a BMI of 40 without any. So you really have to, if I get someone walking to my office who wants to lose 5-10 pounds, surgery is not the option, despite how much they argue. You have to qualify for it, so they have to be candidates for it. They have to be able to tolerate the operative risk associated with the surgery. They have to understand the aftercare, and they have to be somewhat motivated and compliant with the aftercare. The technology is great too. Everything's done through kind of minimally invasive techniques We get to use little cool gadgets and robots and other different things.
And it's a safer surgery now, I understand.
It's very safe. So really the advent of minimally invasive techniques revolutionized the field of surgical weight loss. Heavy patients don't do well with open surgery. So now everything's done through tiny little incisions, little keyholes, little tiny 5mm or little bigger incisions, which results in very little postoperative pain, less complications, and patients are in the hospital 1 to 2 days after these big surgeries.
Now, do you focus on patients that you are referred from other doctors, like diabetes doctors, where their life is literally on the line and they're dependent on insulin and their lifestyle is really difficult?
Unfortunately, yes. You know, these should not be really kind of last resort types of surgeries, because we know that early intervention is very important, because a lot of these medical problems have cumulative effects, and if you intervene early, it's important. But a lot of times we get referrals from doctors who deal with patients who are poorly controlled diabetics, patients who have really bad hips, really bad back pain, cardiovascular disease. A lot of times patients come to us because they have a friend who lost a lot of weight. So it's a lot of times the referrals through patients' testimonial as well as physician directed.
So I've maintained the weight loss. I've down over 138 pounds, give or take. And I think this is what I was meant to do. I was meant to swing it like a skinny chick. Coming and seeing Dr. Awad and having the surgery almost 5 years ago was life-changing. And when you ask my children, my grandchildren, everybody said, "Oh, we love you just the way you are." And I'm like, "Oh, fat? You love me fat?" And, you know, my grandkids said, "Oh, Nani, I never knew you were so chubby." And, you know, out of the mouths of babes, they're honest. You know, they'll tell you. But my children said, "We love you the way you are." At the time I was married, he didn't care. But it wasn't about anybody else. It was about me, and I wanted to do this so I would be around for a long time for my grandchildren, but not even for them. I mean, you could do things all day long for children and grandchildren. I was doing this for me. So it wasn't a vanity issue. It was a health issue. And now I work out probably 5 days a week. You know, I probably go to the gym more than the doctor goes to the gym. But this is my life now. This isn't something that was a fleeting moment in my life. This is who I am now. I eat health conscious. I'm always, you know, going and hanging out with people, and we're looking at recipes and how to make things better. So I still like sweets, but now it's with Splenda or it's with yogurt. It's just better choices for you, the way that it should be. And I have to tell you, after having the surgery, I'm more aware of parents out there or grandparents out there with heavy children and heavy grandchildren, and shame on you. Shame on you for letting this happen to them, because, again, I wasn't always heavy. I got this way after having a child, my second child, my oldest son, so this is his fault. I'll blame it on him today. But I got this way, you know, it wasn't overnight. You know, I was the same size from the time I was 13 till the time I was 30 plus. So this is my life today. This is my life.
Our next guest shares how getting in shape and competing became part of her bucket list, which she attributes in part to her late husband. I'd like to welcome Nikki Walter to Turning Point. Nikki has an amazing story and a wonderful mission. Nikki, tell us about your story.
Thank you so much for the opportunity. In 2011, my husband lost his battle with leukemia, and we have a little girl. And so as part of my bucket list and wanting to change my life, I decided I wanted to compete in a fitness competition. And I started training with my trainer, Brandon Foken. I'm from South Dakota, so it wasn't a very common thing to do there. But I did very well, and then I was blessed to attend the Body Space Spokesmodel competition in Los Angeles for bodybuilding.com. And that's when my life changed forever, and I decided to work with others on health awareness and fitness and really just watching what people eat because of our story.
Well, there was actually the kind of leukemia that your husband passed away from
Yes.
had to do with the way he ate, and that's part of your
whole mission, correct?
It didn't have a way to do with the way he ate. Part of it is feel like he had generations of cancer in his family.
Okay.
But I also feel like some of that could have been prevented maybe by some of the things we eat. And so when we researched it as a mom, I wanted to do everything I can for my daughter because, you know, she has genetics, and I felt as a parent I needed to maybe pay attention to a little bit about what we're eating and what we could do, and just maybe inform others on that.
Absolutely. And you are a beautiful bodybuilder, but there are different levels of bodybuilding.
Yes.
So you're in not the extreme, but what would you call it?
I'm a bikini athlete, so our category can range from, you know, muscular and tiny to a very soft overall physique. But I enjoy what I do, and honestly, I've looked the best I've ever looked. I've been training for 2 years, and I just like to compete. I like to get dressed up and have fun on stage.
Thank you for being a guest.
Thank you so much.
And you're fun to watch.
Thank you.
Sometimes our destiny is written in the stars. Sometimes it's written in other shiny things. Our next guest shares her turning point that brought her to owning her own unique business.
I'd like to introduce you to Allison Bennett. Allison, you have a wonderful turning point and a story that changed your life. Would you share that with us?
Sure. My name is Allison Bennett. I'm the owner of Sunset Swimwear. We custom design and create fitness competition swimwear, and I kind of stumbled onto it on accident. I had a friend who asked me to create a suit for her fitness competition, and it quickly evolved from there to other competitors asking, and it turned into a full and thriving business.
These look like gorgeous suits. Do you make suits for stores or just regular people?
Yeah, absolutely. You can wear these for more than just fitness competition. They're all custom and handmade, so if you have a certain way that you want them, a certain coverage amount, you would just need to get in contact with me and we can make it happen.
That sounds great. And you've got a phone number, and we're going to have a phone number for you that you can call if you'd like to have one of these amazing custom suits. Could you show us like one of your very high-end suits and explain what you do and how you make it?
Yeah, absolutely. Okay. So I would say probably this one over here. That would be a version of our Ultimate Angel suit, which is completely covered in Swarovski crystals, and it's all custom made to order through custom fit, custom measurements, and is actually created for the owner's body.
What does a suit like that cost?
Something like that one would run around $600.
And what are the ranges from low end to high end?
About $150, and it can range up to a little over $1,000 depending on what it is you want to do, and if it's regular swimwear competition, for a bikini or figure. It just kind of depends on how complicated it is and what you want to do with it.
So lots of bling.
Absolutely.
Okay.
There's no such thing as too much.
So have you been in a show yet?
I have not yet, but I have been getting tempted. I've got a couple of friends who are trying to push me onto the stage, so we'll see what happens. But for now, I really do enjoy making the suits.
Well, you've done a beautiful job, and it's all because somebody just asked you to make them a suit once.
Yep.
Sometimes falling down on the wrong path can be so painful that we finally evolve into the person we were always meant to be. So Eddie, you were so good at blackjack that you were winning so much that they banned you from the casino?
No, I wish that was the case. Oh. I was actually I was banned from the casino for carrying a loaded. Well, I wasn't carrying a loaded firearm, but in possession of a loaded firearm. It was in a car that I had arrived to the casino in. Okay. And it was just the most oddball thing. I'll never forget. This police officer just got out of his car out of the blue. And as I was walking into the casino, it asked me and a person that I was with if I had ever been arrested before.
Wow.
And
they can do that?
They can do that, absolutely. And
out of the blue?
Out of the blue. And,
I think that's I don't like that.
Well, it's interesting, but I'll tell you what, sometimes when they're doing that, they're actually saving people's lives, because that was probably the biggest turning point in my life right there.
And tell me why. I really don't get it.
Because at that moment in time, I was absolutely,
you were not doing. You were.
Yeah, I was completely. I was on a whole nother walk of life at that point in time, and it was what it was. I wasn't looking for any other avenues, And at that point in time, I was literally that night got pulled out of nowhere and arrested for this gun. And I really did a lot
Just
of thinking.
possession.
It was just a possession of a firearm, and it just gave me a lot of thinking to do after that. I remember sitting there, or sitting in Chino at the time, where I was sent for my violation, and thinking to myself, wow, if you can't even go to the casino and walk into the casino without getting arrested, and literally, sure, you shouldn't have had the gun in the car, but you literally weren't even, you're terrible at being a criminal. You might as well just stop. You're always in prison. You're just watching, you watch your family get older through photographs. Your address is changed while you're in there, so you get home and it's a different home. So many things change, not to mention, just the overall quality of lifestyle, it's just terrible, and that people would accept that for themselves is, people do it.
Well, I think 9 out of 10 people would probably not have looked at it the way you did and would have been very angry with the policeman and looked at him like he was ruining their life. So you didn't do that.
Well, it's funny because I at the time, that was I had been arrested, so many times at that point in time, and been in and out so many times. I was at the point where I had nobody to blame but myself for everything that was going on, and drugs and alcohol. Those are the major decision. I would say those are the leading reasons that we make most of those terrible decisions that we're making, when we're in that type of a state or something like that, for sure.
Well, you have an awesome personality, so you don't feel like you need to be altered to enjoy life. So do you agree with that? Do you feel like you had to learn that?
At that point in time, I suppose I did need that, I guess part of the process of getting better was really doing a lot of self-inventory and thinking about, why I may have been living the way that I was living at the time, and I think a lot of the things that I came up with was a lot of loneliness inside, and you're trying to mask that and fill that up with other things that might keep you busy so you never feel alone, you never feel what you're feeling inside.
So it was a turning point, a huge one.
It was absolutely a turning point. It was when I paroled from that specific event is when I got out and went to the Salvation Army and, never looked back.
That's awesome. And that was 15 years ago?
No, that was in 2010.
Oh, so that was
January of 2010.
5 years ago. So then your whole path is, because you're well known, everybody knows who you are, and the people that you've trained and are winners. They place in tournaments, and you've changed lives. And we're going to hear about some of those changes later in the show. But I think that's an awesome story that you told. And here I thought you were just a great gambler.
No such thing.
Just when we think we know our life path is exactly when it can change. One member of the Foulger's Soldiers and professional trainer at World Gym, Roger Esquivel, shares how surprised and grateful he is to a mentor and a friend. So Roger, you're a wonderful trainer, and Jess and I have had experience with your techniques, and you really are awesome. But tell us your story and the turning points that brought you to becoming a trainer, and the first time you met Eddie and why he became part of your life.
I've been going to the gym for about 5 years. I've always been athletic, but I've always been the skinny runner, a long distance runner. Working out, couldn't figure out why I'm not gaining muscle or, getting bigger. And working out at World Gym, when it used to be across the street from the mall, I was trying to find some help, and I came across Eddie. He's a bodybuilder. He looked like he knew what he was doing, so I approached him. At the time, I was going to school and working 2 jobs, and I was still a little low on money, and he cut me a deal. He was able to train me at a reasonable price, but I'll be working with someone else. I wouldn't be one-on-one. On top of that, he helped me with food. I believe it's 2013. I did the Excalibur in December. was my
That was your
first
first
show.
competition,
My first competition. I was definitely the smallest guy there.
Uh-huh.
However, I did walk away with a couple of trophies.
Wow.
And
That's awesome.
Kind of got the bug then. A few months later, I kind of was like, oh, maybe I'll be a trainer, because just about everybody that competes wants to become a trainer at one point and just at least thinks about it. I went through a program, ISSA, and took me a couple of years because I was going to school and having 2 jobs to complete the certification. But I did get certified. And it just sat there. About a year ago from November, Eddie gave me a call and he's like, oh, I heard you guys, you were going to get a certification and become a trainer. I was like, yeah. He's like, well, are you certified? Yeah. He said, all right, come over here to World Gym and let's sit down and talk. So from that point on, I dropped my other job and spent most of my time here following Eddie and learning from Eddie when it came down to food, different types of workout for different types of people,
Right.
different types of ages.
I was using the machines wrong when I worked out on my own. And I don't think people realize they can injure themselves very badly.
There's a great amount of people out here in the gym that when they work out, they're working out wrong or improperly. You know, injure your tendons, joints, tear muscles.
So that's one of the advantages of a trainer.
Right.
You can escape injury.
Right, and Eddie taught me that when he was my trainer.
Right.
It's really inspiring when you see someone out there, he's 80, 90 years old,
Yep.
and he's working out.
It is an inspiration.
A couple of weeks ago, I actually saw a gentleman, he was 89, 88 years old. He was doing pull-ups, full-on pull-ups.
Wow, that's amazing.
Yeah, it's pretty inspiring. And
Well, there
when
was
you get
always-
people that you work out with, and they get excited, oh, thank you this, or I lost so much weight, or
Right.
I can lift this much. It's really...
It's a positive choice that you've made to make other people feel good about themselves, and it's a healthy choice. You're helping people live healthier lives, I
Yes.
think. So you enjoy this as a profession.
Yes, and it's
Rewarding.
right. And I never thought I would be a trainer. Didn't even think about it.
The timing was perfect. Eddie
Right.
needed somebody.
Right.
You two are a great team together.
Thanks. Yeah, no, without him, I probably would be on the roofs, you know, fixing air conditioners.
That's not a good place for you.
Out here in the 120-degree weather.
This is a good place for you.
No, I enjoy it. I enjoy it a lot.
Well, thanks for sharing your story.
Thank you.
Thank you for watching Turning Point.
If you have a turning point you'd like to share, please call the number at the bottom of the screen.
It's a scientific fact that after exercising, women become more aroused.
So ladies, let's pick up some weights and rise to the occasion. Have a wonderful week.